commitment, it's very ambitious, but ambition itself is not enough to save the lives. What is required is implementation. And where does implementation begin or has to begin? It's the place, it's the point where people live, people work, people struggle, and that's our community, that's our city itself. So the implementation of all the commitment has to start from the community where people live and also struggle, where the actual need of the commitment is required. In South Asia, there is a disproportionate pressure of NCDs, especially cardiovascular diseases, diabetes, respiratory illness, cancer, and along with that, it's also at the parallel point, there is also invisible epidemic of mental health issues. Depression, anxiety, mental health problems, psychosocial problems are something that is not visibly seen, but it has spread as an epidemic. But there is an intersection with different social phenomena, different social facts, including poverty, gender inequality, climate vulnerability, and also urban stresses. Today, I also would like to highlight that mental health, as the Honorable Minister also mentioned, its mental health issue is invisible in primary health sector, not just in Nepal, but also in South Asia. At the same point, I also would like to highlight what KMC has been doing to ensure the primary health services to the people of Kathmandu, not just the permanent resident of or the voters of Kathmandu, but also people who have been living in Kathmandu. One thing we have started is we have established urban health centers, and we are aiming to establish in all the 32 wards, and among which 50% has already been achieved. In urban health centers of Kathmandu Metropolitan City, we have been providing the primary health service, not just the primary health service, but we are also advancing it, linking with different hospitals, ensuring the health services are free of cost. The primary health service is free of cost, as included in the Constitution of Nepal. About the mental health itself, we have also included psychosocial counselors who actually addresses different psychosocial issues, especially people who are suffering from different stresses. That's one side, and another side is providing health service is of course expensive, but it's so important that we start from working into the preventive approach. We always say prevention is always better than cure. If it is stopped or treated in the early stage, then it cannot just save the finance burden of the government, but also save the life of the people. So that's one of the primary priority that KMC is doing, on which we have been focusing on awareness program, different places where we promote the healthy lifestyles, including yoga centers. We have also been doing food safety boot camp to ensure that we know what we are eating, so that we know what is causing the diseases, especially NCDs. That's one side, one of the programs that we have been doing. Along with that, we are also financing on health insurance. So the minister has also mentioned that the reality is different, the need is high in health insurance. That's one side we have been doing. We are providing the health insurance services to the people living in Kathmandu Metropolitan City. At the same time, we should not forget that NCDs and mental health are actually related with the social determinants. It's high time we create a society where people can live, at least to some extent, they can have a stress-free environment. As I have already mentioned before, poverty, gender inequality, climate vulnerability, some of the issues, and also the urban stress, these are the issues that are causing NCDs and also the mental health issues. So it's so important that we find out the root cause and then implement our programs so that the program are not just achieved or fulfilled, but people can feel the impact in the ground level. That's our reason, and I see that the framework that UN has given also addresses it's not just about the papers, it's not just about the words, it's also about the action that has to be implemented. We should not forget decentralization has to be the key. Local government is not the last mile of the implementation. It has to be the first step towards achieving thousands of miles. Local government has to be there, not just while implementing the program, but from the beginning where the discussion actually happens, where the plan actually happens, where decision making actually happens. So I also would like to request every stakeholder make sure that there is the proper decentralization while developing the program, while implementing the program itself, so that the actual impact can be seen, can be felt.